Wonderful, Lavanya. Tell me a bit more about yourself. Where are you from?
So basically, I hail from Mandya, but then I think I've lived long enough to claim myself as a Bangalorean. And as a profession, I'm a gynecologist, and that was not my first choice. I wanted to be a pediatrician. And inevitability, how you get your PG seats allocations and all, and I ended up becoming a gynecologist. So I did take some time to get used to the course that I was doing, but then I really fell in love with the subject. So much so, I think treating women and taking care of women became my passion. And as days and years passed by, I realized this is what I was meant to. And timing was something that never mattered. And I feel the energy comes from the patients. The smile we get at the end of treating every patient was so different. As, like I mentioned, the days were passing, years were passing, I realized there was so much of problems a woman would go through. And I realized women don't talk about their problems. And I'm sure it's same with my home, your home, and everybody's home. So coming to our own moms, I don't think we've ever seen them, sleep saying that we have a fever, we can't do this, we can't do that. Whatever problems they have, I think they're going to be up in the kitchen and taking care of all of us and making sure we are fit and fine. Then I realized a lot of women were coming to the OPDs at critical stages, untreatable phases, or their hemoglobin would be so low. And when you ask them, they would come up with situations like, yeah, we've been bleeding for so long, mane heng bit baradu, ideng madadu. There's a lot of things like that. Then I realized, no, we'll have to start looking at preventive health for women. And I thought that was the way forward. And I realized we should start targeting these women, not when they come to reproductive age group or at menopause. We should start from adolescence. And I realized there's a lot of gap even in the adolescent health sector where nobody were addressing what an adolescent was going through. Lot of kids, though now they're accessible to a lot of technology, they've been getting a lot of information. Is that information right? What information they're getting them from their peers, is it right? Or is that the right way to do anything? And how is it? Is not known. So you could be under a bad pressure, or you could be having a lot of other misinformation, and you are thinking it's right. And because of these things, simple example, like in my OPD, I would see a lot of young kids of 18, 19 years coming to us for termination of pregnancy because they didn't have knowledge about contraception.
Prevention itself.
Yes. So this is when I thought, look, maybe in an Indian scenario, parents, though I see the perspective has changed over years now, I'm talking about when I started, they would hesitate to talk to children about sexual activity, being sexually active, using a contraception. Now I see parents are more open to things. I have a lot of my own friend kids, a lot of our own patients say, I will send my daughter to you. I want you to talk about a lot of things. Maybe she doesn't want to talk about it to us. Those years, then I decided as a gynecologist, as a person, forget being a doctor, as a person being passionate about women's health, I decided we need to start working from that adolescent period. So I started talking about how do they increase their hemoglobin, about sexual contact, not well received at times because we used to go to schools and even teachers would be like, Dr. Lavanya, don't talk about sexual contact and all. I said, then you won't believe we had gone to a school, and I think that school crowd was like around 500, 600 girls of the high school. And in between, I got this note saying that, don't talk about sexual contact, these things, our kids are not aware. I said, okay. But then I know that was not the real scenario. And I decided we'll give you chits. Don't write your name. Put up your questions. You should have seen the kind of questions. Even the teachers were shocked about kids talking about oral sex, about sex with the same gender, so many things. And then I just looked at the teacher. I said, see, they need information. Otherwise, what happens? These kids end up, assuming they become pregnant. They're hesitant because they can't talk to parents. And we've had situations where young girls come to us at 5th or 6th month and they're very scared to even tell their parents that they're pregnant.
Correct.
So at the end of 6 months, I think the tummy becomes quite obvious, and there is no way that you can, hide it. So pregnancy is not something that you can hide, though.
True.
So I feel bad for those kids, because not only those kids, those parents as well. So it's just that even when young moms come or mothers of teenage kids, I say, talk about it. Talk about it. And this is how I thought preventive health was very important. And I decided we should start it early. And of course,
That's, all these points what you're talking about seem to be like much later in your career, which you have had an insight or looked into the scenarios and things. Let's take it a notch behind. How did you choose to be a doctor at all, or why did you choose to be a doctor at all?
oh, that's a long story, I would say.
Yeah. That'll be interesting.
Yes, definitely interesting. But I'm not sure if it's very interesting also, because
Let's see.
I don't think I ever thought of anything other than becoming a doctor. I was very influenced by Mother Teresa from my childhood days. I would see a lot of her work, of how she would take care of a lot of people and what she was doing. And I think Mother Teresa has got a lot of big impact on me. And that's how I think I decided I have to be a doctor. And then I wouldn't say I was a bad student, nor I would say I was a great student, but I was definitely a good student. But then I know to become a doctor, good student was not sufficient, and you had to be a great student. So I was wondering, will I be able to make it or not? So then I decided I should become a fashion designer if I don't get into medicine. And I went and applied to one of the famous colleges in Bangalore for fashion designing. This is as a backup if I don't get into medicine. And my dad had told me, if I don't get a seat, free seat, and if I don't get a seat in Bangalore, I'm not going to go into a medical college.
Okay.
So the fact was, getting medical college in Bangalore was the most important thing. So this is why that was my backup plan. And luckily, I did get through the seats, and then I ended up being in Ramaya. Interesting part about the counseling was, I think the day I had my counseling, we had 50 seats, 100 students waiting, and it was like the clock ticking and getting more anxious. And me and my dad would always go to the NEET counseling thing. That time we didn't have NEET, though. It was just CT we had, and me and my dad would go. We would have those
Boards put up, is it? Like
more than boards. I think it was those shamiyanas put up, and we were all sitting there anxiously waiting of what number is going on, how many more seats are left. When we went, I think together 10 people would be there.
Yes.
10 of us sitting, and the seats were 5, and I could see the numbers coming down, 4, 3, and I think it was showing 2, and then was my turn.
Nice.
But then you have to remember, 10 people are simultaneously sitting along with you. Luckily, I ended up getting in Ramaya, so there I am.
Very
becoming a doctor.
Very nice. So when was this?
This was in 1996.
96.
Yeah.
Then you
So-
chose to do medicine.
Yes.
And at what point in time did you decide to do gynecology?
No, never. That was not even a part of the
So
plan.
how did that come about?
That's like I mentioned, I think that was just a coincidence, or incidentally fell into my lap. I got married while I was doing my internship. Or I got engaged when my final year was over. My husband was doing his cardiac surgery. And then I actually wanted to be a pediatrician or an orthopedician, to be very frank. Somehow, I don't know, it fascinated doing a lot of things, and I'd seen orthopedicians do a lot of work. My parents weren't very keen on me taking up orthopedics. I think I'm talking 26, 28 years back, or 20 years back for my post-graduation. I think the contemporary mindset that a female in a male society or the male department wouldn't fit well. So they somehow opted me out. And pediatrics was one of my choices. Though my dad kept saying, as a girl, you should take a timing job. You should do either ophthal or a dermatology and go home, go to hospital at 9, come back at 5 and take care of your family, is what I was told. But then somehow it didn't interest me. So I thought pediatrics was something good for me. But then I got married. My husband was in his second year of cardiac surgery. He brainwashed me, saying that I'm going to be very busy. I may not come home for 2 days, 3 days, and my working hours are like 22 hours, and you may not even see me. So if you take pediatrics, you're going to go bonkers. You're going to kill me as well. So take a subject which is going to keep yourself busy. I said, what is that? He's like, OBG. I said, no, I want to do either medicine, I want to do pediatrics. he tricked me into it, and he said, see, OBG means you have to just read about the uterus, tubes, and the ovaries. And you don't have to read anything. You have to read that Datta book, which you get in your UG book. I'm like, yeah, sounds good. In my UG days, I think our medicine book was like Harrison and So Fat, and Datta was like literally small. I'm like, yeah, it made sense. I was like 23 years. And I'm like, yeah, I got carried away with that. And that's how I ended up with OBG. But then getting into OBG, I realized just that small uterus, just that tubes and ovaries has got the whole world inside that. And
True. Very true.
so I think it's a beautiful subject. And that's how I said, initially, I think I really took a long time to get used to it because that was not my choice. But then I think I really fell in love with my patients, not the subject though. And so inevitably, you have no choice. Once you fall in love with your patients, you have to know your subject.
That's nice. So when did you finish your gynecology training?
Gynecology, I think, luckily for me, things have been back to back. 2002, I finished my internship. I think 2002 mid or 2003, I joined. And I became pregnant in my final year. So I took a maternity break for a year, little up and down. And so 2007, I finished my post-graduation. And I worked 6 months as an SR in Sagar Apollo.
Where did you finish? Where did you train for your?
My post-graduation was in Kempegowda Medical College, Bangalore.
Nice.
And yes, it was a very good place, I would say, because we got a lot of exposure, a lot of OPD patients. It was like a semi-government hospital. So the rush of the OPD, I think we learned quite a lot. We had fantabulous teachers there. I think that is how passionately you pick up, and your mentor should be so good. I would see quite a few teachers of mine, that energy level from morning till evening, even at that 5 o'clock, that smile they kept up. And then we used to ask, they're like, look, your patients are coming to you with a problem. And if you don't speak nice to them, they don't go back happy. And this was not like any rich patient crowd or something. Like I said, it's a semi-government kind of a setup. And I think I learned quite a lot of not just the subject there, not just taking care of a patient, but the etiquettes, that how you behave to a patient, what do you do, how do you comfort them. And I think I picked up quite a lot from my teachers.
Very nice, very nice. And again, the obstetrics and gynecology is such a wide or vast field. Then did you have to hyper specialize or go into one particular topic?
Yeah.
And you chose what?
Lots of it, I would say. Then we would have to do one more podcast of just my degrees.
Yes.